Safe to say every family has its ups and downs, so it can be difficult to know if yours might benefit from additional support or even which type of therapy might be right for you and your family. Luckily, we have psychotherapist Dr. Robi Ludwig joining us now with some of this advice. So nice to see you. This is great to talk about this with you. I think a lot of people have heard the term family therapy, but we don't know exactly what it means. What is it really?
So family therapy is a type of talk therapy for people in the family to work through a crisis so they can understand each other and actually be healthier and heal. So it's highly effective for those who enter into it with the right mindset.
Talk to us a little more about that word we saw on the screen there, interfamilial challenges.
Yeah.
How do you, in a professional sense, define that? And for families at home, what are warning signs of saying, okay, that challenge is not a normal interfamilial challenge that we would have, we actually might need more help?
So I think when families feel like they're in crisis and their coping skills are no longer working, and there's an upset in the family, they don't know how to interact with their partner anymore, their child is going through difficulty, maybe there's grief or mental health issues or medical issues or addiction issues, and so families just feel stuck and they know that they can't do anything to make a difference. And that's usually when people find individual therapy, couple therapy, and family therapy.
So let's say you've decided that whatever the issue is in your family, you have everybody on board and they've decided that we're going to do this. How do you know what type of therapy or therapist to engage?
Well, you know, therapy, including family therapy, the different approaches are more alike than dissimilar. But there's functional therapy, which usually looks at somebody who is having, a child is usually having a problem. Maybe there's a behavioral issue, an eating disorder, some kind of problem that brings the family in. And then the most popular is structural therapy, where you actually look at the structure of the family and look at the hierarchy and how different people within the family interact with one another and help them to be observant of pro-social actions and gain insights into what's working and what isn't working. And then couples counseling is usually when couples feel stuck and they need help understanding each other and treating each other better.
When someone, any family member, a group is trying to find not only a good family therapist, but also the right one for their situation, what's your advice for going about that?
First of all, you want someone licensed. So you want to make sure someone is licensed. That could be a licensed social worker, psychologist, psychotherapist. And then you want to ask, you know, what kind of, you want to ask your doctor, first of all, do they have any recommendations? Ask friends, ask clergy. And then you can interview a therapist and see, do you like them? Do you feel comfortable with them? Do you feel supported? Can you be honest and authentic? Ask them what their approach is. Ask them if they have a sliding scale. Ask them how long it will take. And see if it's something that you want to try.
And if it's not a good fit, you can try somebody else.
Get around.
You can even tell your therapist, I don't think it's a good fit. See what they say. And they might say, what do you need in order to feel better? Do you need more homework assignments? Or, you know, they might say, I'm going to send you to somebody else because I think it's a good idea and I want you to get the help you need.
Great advice.
Thank you so much. Nice to see you.
Thanks.
Likewise.
All right.